Okay, everyone, we're going to get started. Welcome to the December Environmental Health Seminar. We'll start with some housekeeping for people on the line, on the telephone line. If you're joining as a group, please make sure to assign a delegate to send me the names of everyone in the group and whether they would like to receive sci-fi educational credits. And during the question and answer period, you can post your questions in the chat box. We will not be opening up the teleconference line today for questions. We'll start with Angela Eykelbosh, who is an Environmental Health and Knowledge Translation Scientist at the National Collaborating Center for Environmental Health, to begin the session. Thanks, Angela.
Hi, everyone, and welcome again to today's seminar, which is being webcast to you live from Vancouver from within the unceded territories of the Coast Salish peoples. As Tina mentioned, my name is Dr. Angela Eykelbosh, and I am a scientist at the NCCEH as well as the BCCDC. We are very fortunate to have with us today Chief Marilyn Slett of the Heiltsuk Nation, whose traditional territories span a large portion of the BC Central Coast. She will be speaking to us today about the community impacts of the diesel spill that happened in October off the coast of Athlone Island near Bella Bella. With us also is Linda Pillsworth, who is the Manager of Environmental Health Public Services for the First Nations Health Authority. Linda will be giving us some of the details on the environmental public health response to the spill, which was the result of collaboration amongst many agencies, many actors, led in totality by the Heiltsuk Nation. So, getting started. We're going to try to cover three things. I'm going to be speaking to you about the health effects of oil spills. Then we're going to go right into the case study of the Bella Bella spill. And then finally, I'm going to briefly plug a preparedness and response document that's being prepared for crude oil events by Health Canada and ask for reviewers for that document. So I'm here today in my role as scientist to set the stage for today's talk by quickly summarizing some of what's known about the health effects of oil spills. So back in 2014, Vancouver Coastal Health and the NCCEH and me did a large literature review of all the human health research coming out of some of the world's largest marine oil spills. So those were spills like the Deepwater Horizon massive blowout in 2010, a very large spill from the Habai Spirit tanker in South Korea, one called the Prestige in Spain, the Exxon Valdez, of course, in Alaska, and the smaller spill that happened right beside a very large city from a ship called the Tasman Spirit in Pakistan. So we did two papers from this review. The short paper is available at ncceh.ca, and it's this paper shown here, The Health Effects of Oil Spills and Implications for Public Health Planning and Research. It's a short and sweet read, but if you want all the details, and especially a lot more detail on the community health impacts, which were very large, the long paper is available at www.vch.ca, and it's called The Short and Long-Term Impacts of Marine and Terrestrial Oil Spills. It's a much longer title and a much longer document. Enjoy. So what did we find? Well, we do know that being exposed to an oil spill has some observable short-term health effects like headache, nausea, respiratory effects. These are just from simply being in the area and breathing the vapor. These effects are generally reversible, and they last days to months depending on the duration of exposure. And especially if you're a cleanup worker and you're in very close contact, wearing PPE, not wearing PPE, some of these effects can last for months. In the long term, there is some evidence of, in cleanup workers, of respiratory, endocrine, and immunological effects. Over, I think the longest follow-up I saw was about 7 years. And so this is very interesting, but it was notable that the effects were subclinical. So we don't really understand the long-term consequences of these as health outcomes. So that there's generally a lack of long-term research on health effects of oil spills. So probably the most striking and disturbing outcome of our review was really the vast amount of research, not vast, but a large amount of research available on the mental health effects of oil spills and their impacts on whole communities. So particularly from the Deepwater Horizon event in 2010, there have been many papers now published looking at what's happening to individuals and to their communities after a spill. So there's obviously a lot of stressors that come with a spill. If you're a fisherman, you've lost all your income. If you're If you're now a cleanup worker, you've just had a massive gain in income, so there's big changes in who has money and who doesn't have money. There's also, of course, people have general health concerns and fears that affect their overall health. And there's also some impacts from litigation that happens after an oil spill happens, and then you have to start trying to figure out who gets what, and that can be a very stressful process as well. So at the individual level, various studies have documented things like anxiety, PTSD, depression, and many other effects. At the community level, they're seeing or have seen, some studies have found, increases in social ills like addiction and domestic violence, crime, as well as a general decrease in social cohesion. So sometimes you might hear a term, corrosive communities, and this is basically a community turning in on itself. That term seems to be linked a lot to cases where there's litigation involved, so there's some infighting that happens when people have to start fighting over money. So particularly, the toxic effects seem to be most frequent among the cleanup workers. So the cleanup workers are obviously, they're out on the beach, they're out there for multiple days in the row, they're doing an 8-hour or longer shift, and they are most exposed to the oil. So you would expect this. But there is differential risk depending if you're a professional paid cleanup worker. These people tend to be trained and equipped properly and monitored. Somebody's looking out for their health. At the end of the day, they're checking in on them. During the Deepwater Horizon response, they really set out a quite impressive protocol for rostering and monitoring and checking up on workers as they went through cleanup. There's also some spills that have just used volunteers with very variable training and very variable PPE, maybe just a handkerchief over the mouth, so that's obviously less desirable. Wildlife handlers tend to have a lot of injuries in these oil spill events, and that's for obvious reasons. You're trying to bathe a struggling, terrified wild animal, so lots of bites and scratches are common. And then, of course, there's people who just show up. There's been a spill, and the public comes to the beach, and what do you do? Because in these cases, you may have people being exposed to you don't know what. And so there's some interesting ideas out there about what you should do to try to direct these people elsewhere. So who's most at risk? And by this, I mean the most vulnerable populations. So cleanup workers have these risk of these toxic effects, but the mental health effects seem to impact children. So there are studies from Deepwater Horizon and from High Spirit showing that children wind up showing signs of mental stress and depression. I think there was a study about scholastic performance decreasing, and it's simply because obviously children are absorbing the stresses that are in their communities. Also, of course, natural resource-based communities are going to be hard hit. If you're counting on fishing for a living and you can't fish anymore, this is going to be a very big problem for you. And finally, there's been quite a bit of research, especially on the Exxon Valdez event in Alaska, where indigenous communities were just very disproportionately affected. So this is kind of a combination of things. There's the reliance and desire to consume traditional foods, which may not be consumable for various reasons. There's also, of course, a natural resource focus economically, so we need this commercial fishery, but now we don't have it anymore. There's also a different, very different worldview on health and the environment, which Linda will talk about a little bit more. And if a spill happens in a remote community or a remote area, even if there's no town nearby, that remote spill still may be happening in a place that is utilized by Indigenous peoples. And so because of that, Indigenous peoples may still be disproportionately affected by that spill. So at that point, I'm going to turn it over to the chief. Oh, actually, I've got one more slide. One more. This is just a really brief table of just some of the spills, recent spills in Canada. Some of these you'll recognize because you will have heard that there's been an environmental public health response to them. So just before Bella Bella there at the bottom, the spill that happened in Saskatchewan, which is called the Husky oil spill, or the North Battleford spill, quite a large spill into the river. The Marathassas spill happened in July 2015 here in Falls Creek. Previously, NCCEH had a webinar on the Lac-Mégantic train derailment, which is a very tragic event that claimed the lives of 47 people. So although there are data, and I'm not going to go deeply into this data, that we are having fewer spills over time, it's really important to keep in mind that the public has a much higher expectation of public health and what we should be doing about these spills. And so that's why we're here today, is to talk about a very recent spill and the public health response to it. So I'm going to turn this over to the chief now. Hey, just use the arrows.
Ooh, okay.
And remember to get close because it's not very loud.
Good afternoon. My name is Marilyn Slett. I'm the elected Chief Councillor for the Heiltsuk Tribal Council, and I'm really pleased to be here today. Thank you for having me. So, the Nathan E Stuart. On October 13th, we were advised by Environment Canada that the Nathan E Stuart and its barge ran aground on a reef in Gale Pass in Seaforth Channel. Let me see if I can do this. So these photos here, you can see their boom out on the beach. You can see the Nathan E Stuart tug as it's sitting there in the water. And as the tides would come in and out, the barge would be submerged more, and that's probably out in a low tide. Some aerial shots of the diesel spill. So let me see. So the Nathan E Stuart was a articulated tug barge, meaning that it is a tugboat that pushes a barge. And the barge was thankfully empty. It had unloaded its load of oil in an Alaskan port and was on its way back to the U.S. The Nathan E Stuart is owned by a Texas-based company. We understand that the Nathan E Stuart had 7 crew members on board, and despite that, with a crew of 7, missed an adjustment on turns, resulting into the crashing into a reef in Gale Pass. It's unknown to what happened with the crew and why the adjustments were missed. The Transportation Safety Board has refused to disclose its interviews of the crew to date and allowed the crew to leave Canadian jurisdiction. Let me see. It's not working. Oh, I was going up and down. Sorry. So the tug crashed into a reef and lost its barge in Gale Creek. 237 and 262 liters of marine diesel and hydraulic oil dispersed. I think that was the capacity that the barge was able to hold. Seaforth Channel is a traditional commercial harvesting area. It's what we refer to as our breadbasket. And this happened weeks before clam fishery was scheduled to open. And the clam fishery is a commercial harvest made or open to the Heiltsuk, and it really provides for a winter economy for our community and has really affected 50 plus families in our community that right now would have been harvesting those clams in that area. So the crash resulted in gashes in the Nathan E Stuart and resulted in the sinking. And it leaked about 130,000 liters of marine diesel into the ocean, and also about 3,000 liters of hydraulic oil. So the tug grounded itself in Gale Pass, and this is an area that, of course, I just mentioned that we refer to our breadbasket. Our old people have a saying that when the tide goes out, the table is set. So it was a really, really important area to our people. We've had so many discussions with our community, and basically, if there was no other, this was like the worst possible place for this to happen. Our community was devastated. So aside from clams, we've also harvested spawn on kelp, herring spawn on kelp. Other traditional, that's a traditional harvest for for our community. It's also a large economy for our community. Salmon as well as shellfish. So the shoreline and the inline areas are also a main traditional area for commercial harvesting and land mammals and medicinal plants. We had divers go down and take photos and video footage, and there were small schools of herring swimming around the tug. There were small juvenile sockeyes swimming around the tug. Killer whales swimming around, the channel. So it's a real rich area for sea life. It's such a beautiful ecosystem. So our Heiltsuk people were the first responders. Our integrated resource manager received a call about 4 a.m. from Environment Canada, advising them that there was an accident, and there wasn't a lot of information that was provided to our director. He quickly mobilized people, and they were the first responders out in Seaforth. They left our community around 6:30 in the morning, daybreak. And you can see with these photos, these two photos with the smaller photos, with the two skiffs there, that barge was coming off the reef and coming off the rocks, and at risk of floating into the Seaforth Channel. So those boats were there was about 4 of them there. You can see 2 of them in the photos. Trying to keep the barge intact, and so it wouldn't do further damage. There is also some photos here of some of our members laying out some boom. One of the issues that came up with the spill is not having enough equipment and resources out in our community to properly lay out that boom and contain it. Our hereditary chief that was out there that morning said that basically when the tug sunk, our beaches were compromised within about an hour. So the damage that we're dealing with now and the long-term effects that resulted almost immediately with the sinking of the tug. So Heiltsuk accommodated and fed over 200 people that came into Bella Bella for about 6 weeks. So we had met with the Canadian Coast Guard and the Kirby representatives, and had advised them that the Unified Command would be in Bella Bella, and we eventually agreed to that. And that evening on October 13th, we started up setting up that Unified Command in our Tribal Council Administration Office. And following, over the next few days, well over 200 people showed up to our community from various government agencies, salvage crews, environmental consultants, people, even as it was mentioned earlier, some people just came off the ferry boat and came into the band office and said, "We're here to help." So it was quite the experience. So Kirby Corporation, government bodies, spill response crews. We also were very strong and insistent that all of these crews would employ and use our traditional knowledge and local people. There are no other people that know the Heiltsuk area more than Heiltsuk people, so we insisted that they be a part of that whole process going forward. So they made up the crews, obviously they were the first responders out there to begin with. They were observers to the sampling crews and guides to many of those sampling crews that went out and are still out there today. We also brought in some environmental expert support, and we provided administrative support. It was a huge logistical task to accommodate all of the people that came into our community. We're the third largest First Nation community in BC, yet this stretched our capacity. We were working every day for 6 weeks with no days off, pulling 15-hour days. And one of the things that we noticed, obviously, is with the crews that were coming in, they had rotational schedules. So we would see different people from Coast Guard, different people from MOE, and different agencies. Yet our same people were, at the Unified Command providing that support. So it was a challenge. One of the things that we've shared with the general public and government is, although we took a leadership role in this process, it was really a process designed really not to include First Nation communities. So it was a challenge every day. Health impacts in our community included mental and physical impacts, including oil exposure, shock and exhaustion, fear over food security and safety, lost current and future harvesting, a lot of anger and alienation and discrimination. Immediate and long-term health effects needs not recognized. We were out there, like I said, every day, doing what we can to mitigate the oil spill, to contain it, do what we can to contain it. But the mental and physical exhaustion was something that you can say, well, maybe, you should stay home today, but, that people will not stay home. I mean, there is just too much at stake, too much, our future, was at stake. And we know that, we're going to be bearing the burden of this going forward. So people were out there every day, and we were supported with FNHA and the different agencies that brought in some support to our community. But a lot of that fear around the food security is something that's very real, and we still feel today. How long is this going to affect us? When will that area? When will it be safe to harvest in those areas in Gale? Gale Pass is a ancient village site for our community. It's where one of our largest tribes come from, the Cocoit people, and we have a long history with that area, and so that coupled with the food security matters and issues weighs really heavy on our community. When we say it's our breadbasket, we harvest clams there, we harvest spawn on kelp there, sockeye there, kelp for the herring season. So it's hard on the community, and those impacts. We're doing what we can to understand how long they're going to affect our community, but that's one of the uncertainties that we face. So we have about 1,600 residents in our community. We're within the Great Bear Rainforest, and we're accessible by air and water only. It's an island. Bella Bella is an island on the Central Coast, and it's, as you can see from the map, the Nathan E Stuart was traveling what we call within the inland passages, and that was problematic because it's without without knowing the coast, things like this obviously happen, and so it's a remote community, Rocky Coast, and certainly those are one of the things that we're moving forward with in terms of future discussions around, the safety of our community going forth around the marine vessel traffic. I guess before, let me see, where we are. So the very first responders were local residents. They made up very young people to elders in their community, made up of some of our hereditary chiefs that were out there, our guardian watchmen. This is a very remote location. The main objective and the main reason why we were out there is it is our traditional territory. It is literally our backyard, and we wanted to do what we can to protect the key harvesting areas that are so important to our community. You can see from this aerial photo that we had those booms in place, but you can see a lot of diesel outside of the booms, and that was really hard to see. Along with the time of the year, too, it's very we were riddled with windstorms during this time, and those booms were breaking off, and they weren't really designed for that coastal weather either. So, but we, obviously wanted to do all that we can, and that's what was made available to provide some protection to the coast. So the impact to our community members, the first responders reported shock at what they were seeing, at what happened in Gale Pass, and there was some physical unwellness due to exposure to oil smells, with the smell, touch, inhaling of the fumes, mental and physical exhaustion from being out there for long hours. Out at the incident site, members were helping on land, including employees of our Heiltsuk Tribal Council. Like I said, even though everybody was tired, they carried on. One of the things that continues today is the anger and the uncertainty around our harvest areas that were polluted and contaminated, and the inability to respond to the incident. And it's not because we're not mariners or we didn't have the capacity. It was part of not being equipped to handle this. And that's one of the things that we've brought forward to the federal government and made available through the spill response, is how inadequately our coastal communities are prepared for spills such as this. And we're hoping that this will be remedied, and it can be. We can learn from this going forward in terms of how to be more prepared. And I don't mean just as a Heiltsuk community, but I mean as coastal communities, as Canadians, as British Columbians. We just recently celebrated the Commonwealth Canopy with the Duke and Duchess a month before this happened. Around the pristineness of our beautiful traditional territories. And then for this to happen, over a month later, really goes to show you, the inadequacies are glaring after that. And I think this is where I leave you. Thank you.
Sorry, left. Good afternoon. Thank you everyone for having me here. Linda Pillsworth, I manage the Environmental Public Health Services Program with First Nations Health Authority, and to have a wonderful team of environmental health officers and staff supporting all of the communities in BC. This is a very wonderful opportunity to ensure that the concerns of the community are heard in such a type of a scenario. I'll speak to the response that First Nation Health Authority provided through this incident and continues to provide. And in general, for those who don't know, First Nations Health Authority took over the former responsibilities that Health Canada had for delivering health services in First Nations communities in BC. And that includes environmental public health services. And one of those key areas is supporting communities through environmental emergency responses, day-to-day environmental health operations. So in this type of a situation, we really try to look from the perspective of the community of how does this impact the community. For the community of Heiltsuk, our primary services come from First Nations Health Authority. The full community is First Nations members. And Vancouver Coastal Health also operates a medical clinic and hospital there as well. So, however, the majority of the health services are driven through the Heiltsuk Community Health Services and First Nations Health Authority. And so, FNHA took the primary lead in this response. But as Angela definitely stated at the start of this, was no short of a full-fledged team effort to try to respond in the best way that we could. In terms of the initial response and our activities that we had was primarily, at the very initial time that we'd heard about the incident, was participating in the Provincial Regional Environmental Operations Center coordination calls. And this was, fairly quickly formed, and everyone was participating in terms of understanding what the situation was on site. Some of the key things that we look for for FNHA is ensuring that the First Nations are directly and actively engaged at the very beginning, and rather than being an afterthought. So it was positive to hear that the Unified Command was being set up in the community itself, and gave the community that important opportunity. We look to ensure that appropriate responders are going to attend the issue, and that being, Coast Guard as first responders, and West Coast Marine Response Corporation, which provides spill response to the BC coast. And finally, situational awareness, and being that this is a very remote community, that sometimes is a challenge in really understanding what exactly is the situation on site. Through the coordination calls, as well as through the situation reports, that's often the key sources of information. But unfortunately, it wasn't until day 3 where we were notified by the hospital manager and the community health nurse that despite both Vancouver Coastal Health Authority and FNHA stressing at the very outset that personal protective equipment be provided to anyone responding on scene, there was a disconnect, and somehow that equipment was not being provided effectively or adequately to the First Nations local responders. And that brought us some concerns in terms of exposure to the oil vapors and potentially dermal contact with diesel. And as Chief Slett has mentioned, some of the health effects that were being reported off the start. So that triggered a fairly immediate call to the Unified Command to get a really much better understanding of what was happening on site, what safety plans were in place, and understanding, really what potentially might some further actions from us be. So fairly quickly, we tried to support adding more guidance for volunteer crews to make sure that they understood that there are very important equipment and processes that they should adhere to minimize their exposure, and flagging that the PPE was extremely important.
We, as quickly as possible, mobilized some of our staff along with an EHO from Vancouver Coastal Health. So myself as the manager and one of my EHOs along with the Vancouver Coastal EHO got on site as soon as we could. And that really helped to get a much better understanding of the situation in the community, the plans and how effective the safety plans were on the site. And an important piece of this is that despite the Unified Command being in the community, it was about 11 nautical miles away from the community where the site was. So there is some obvious challenges in communication, ensuring what is being planned and executed at the Unified Command is actually being what is actually happening at the site of the vessel and the response. So one of our key, first steps was to really understand from the safety officer what plans were in place and how were things being executed to make sure that local respondents and the crews were being protected from potential diesel exposures, both inhalation and dermal. Understanding how they access the PPE, what is the safety orientations that they get before they actually go to the site. What does site coordination actually look like, being that Unified Command is in one location and the site is distant from that. Understanding what their decontamination procedures are to make sure that that doesn't get further brought into the community. And some questions around air quality monitoring, being that this was it's a remote location. What are the air quality monitoring equipment, both on Coast Guard vessels and the West Coast Marine Response vessels that attended, again, to help us better understand what those exposures are. So in trying to raise awareness around some of the hazards of this, we prepared a diesel and health frequently asked questions document to support the community. And again, this was in conjunction with Vancouver Coastal Health, BCCDC, and NCCEH. And at this time, it was for me as supporting this response, I reflected on Angela's document considerably. So I encourage anyone in the public health field and that potentially has this type of a risk nearby their communities to read it front to back, because there's a wealth of information in that larger document. So I probably read it more than once. So again, because of the concerns of these individual exposures, we really started as a group asking, how do we better understand this? How do we better understand what those symptoms might be and what their risks are? So, and we started talking about a rapid health assessment to, determining if that was something that was needed. The nation was really concerned and seeking to understand what those exposures were and what are the risks to the communities. Now, albeit nobody was presenting to the medical clinic or the hospital, that's not to say that there were not symptoms. And potentially that was avoidance, overall. The crews were wanting to be working, as Chief Slett mentioned. There's a sense of obligation to be at the site to do whatever they could. So, presenting and checking on their symptoms is secondary to that. And potentially it's, well known that often First Nations individuals are less likely to seek care, and that's rooted in some history and experiences in the past. So it was really important to try to get individuals where they were at and come to those individuals as opposed to asking them to come to the clinic. So the rapid health assessment was created from scratch. Really, it was Vancouver Coastal Health surveillance team, medical health officers, BCCDC, NCCEH, and all of us coming together to really understand what do we want to achieve from this exposure assessment. And truly it was to get a good understanding of what the exposures and the symptoms are, encourage follow-up for significant symptoms, understand where individuals might be at in terms of that emotional stress and how is that impacting mental health potentially at that early stage, and to provide those individuals with a snapshot and documentation of what they experienced and their symptoms for their medical records. it was important that because this was medical information, that information sharing agreements are in place. This is a very important aspect of respecting First Nations ownership, control, access, possession to their information, and ensuring that it supports the community first and foremost. The assessment needed to consider who was going to be delivering the questionnaire. So with limited capacity in the medical clinic and the health center to have nurse or medical staff do the questionnaire, it needed to be tailored to an environmental health officer or a non-nurse physician type of a role to conduct the interview. So the interview was conducted by environmental health officers and with medical review provided by the Vancouver Coastal Health Medical Health Officer. So being that we're starting anew, it took a few days to develop this to really ensure that we are getting to the right information and you know, doing this appropriately the first time around. So it took a few days to develop it, and I mean, unfortunately, it was day 8 by the time that we could fully deploy that questionnaire. But once it was developed, the staff were ready to start interviewing. So at this point, we're unable to share findings. This is information first and foremost for the community, and secondly, the assessment's still in progress for a few reasons. Well, the first sets of interviews and information that we had helped to, you know, hopefully identify all the local responders. There was some challenges in accessing the crews because they were on site, and that is where they, you know, their shifts were required to be. Sometimes there was downtime due to weather, but they could quickly and with little notice be called back to work. So, you know, there were some challenges in actually deploying this and making sure that we could get to each individual. But I think what we really wanted to emphasize to the community was that, you know, the individual experiences are important, and their health status and impacts from this type of an event are very important. So that it's what sat with me in terms of I didn't want to leave there not knowing how they were impacted and if there was further risks for the individual's health. So it's been positive in terms of identifying concerning exposures and symptoms, ensuring that you know, any individuals with that get further follow-up. And to better understand what the on-site situation is. And, you know, I think through doing many of these questionnaires, we better understand, learn, and how do we do this better. You know, heaven forbid there is a next time, but how do we learn from everything that we do? So again, in terms of challenges, access to the responders in the midst of the response was challenging, and so that's why, despite the response has completed on the water, we've continued to ensure that questionnaire can be completed, allow for that time for community members to really, you know, think back and look at what they've experienced. Deploying it at day 8 would have been a challenge if it was you know, a different type of chemical, if there was more severe physical impacts. In this community, they're very lucky that they run a medical clinic. There's a hospital there, so you know, in terms of capacity, there is a certain level there. But again, without some of these other aspects in place, it may have been really hard to triage that, even in this well-prepared community. So hence, pre-prepared surveys and tools, I cannot stress enough in just being able to have that readily accessible and available. Whether it's FAQs or messaging that can be promptly and quickly prepared is very important. Furthermore, one of the interesting concerns that we have coming out of this is the potential for secondary exposures when, you know, at the very beginning, when communities would be coming back into their homes with contaminated clothing, contaminated rain gear and equipment. Oftentimes, drawing that out, the only place is their basement. And sometimes that can be a concern if air intakes are located down there and circulating throughout the home. So secondary exposures could be a concern as well. So beyond the specific health assessment, We participated in the environmental unit section of the Unified Command process, as well as the science table, to ensure that all of the factors that needed to be considered were there, and to make sure that the community was supported in bringing forward their concerns at these tables. Chief Slett had already mentioned significantly the traditional food concerns and the reliance that this community has on the coastal area. And some of these, reflect not only the safety and tainting, but also what is the health of those resources? What is the damage to that resource, and will it be there next season? Can't stress enough that traditional knowledge is important at all of these tables. There's so much history and knowledge that communities and community members have that is so valuable to bring to these tables. With many of the other health impacts that were starting to be highlighted from an emotional standpoint, we brought in our First Nations Health Authority Regional Mental Wellness Advisor to assist in coordinating other services. So the PHSA Disaster Psychosocial Services was brought in for a week to assist individuals and communities and the community in coping through this type of a disaster. And we further brought in additional cultural service providers. So this assisted in, these are supporting activities such as brushing ceremonies from a First Nations perspective that might help the spiritual well-being of the community. We lost my diagram. So I think I've spoken about the reaching out that I did. It was a lot of reaching out to various agencies, individuals, expert areas, OSHA, NOAA, Alaska, Washington, even another First Nations community in the North Central Coast that had experience following the Queen of the North, to look at, how do we bring forward lessons learned from there. And I think the biggest understanding to take from this is for First Nations communities, human health is not just the toxicological aspect of these types of incidents. Human health is the health of the environment. So it is not just about whether you can consume the food, it is also about whether that food is going to be there next year and the subsequent years, and that ecological importance, the sustainability of that. And to make sure we have time for questions, I'll quickly pop through these. So really it's important that not only through these incidents there's immediate support, but also the longer term, again, to answer some of those questions that the community residents have, and help to reduce some of that stress and anxiety that they will continue to feel. So differentially impacted. This community is the primary community in this area, and so it bears the burden of all of this this impact. They rely heavily on that physical environment. There's a strong connection with that physical environment through history and their culture with it. So again, looking at this from an ecosystem perspective is very important. Understanding that the health risks are not just the toxicological health risks and extend beyond that. The ICS model, does this fit? Does this adequately incorporate not only health concerns, but the community's concerns, the decision-making within First Nations community? So those are all questions that we have. And some key learnings. Don't assume that situational reports give you all of the information. It's so important to directly connect in with the community, with as many people that you can, to get a good understanding of what the issues are. And this is a community where our EHO has a 19-year working history and relationship with. So it's very important to have that relationship there. And again, equipping the communities with the tools that they need to respond, because they are in all likelihoods going to be the first ones there. So in terms of next steps, when we feel like we have as many of the first responders interviewed and we've exhausted that, we'll look at doing an epidemiological review of those questionnaires with the assistance of Vancouver Coastal and BCCDC. And because so many of the broader community health impacts, we're really advocating for a health impact assessment approach, which should be integrated with the EIA. It's the environmental impact assessment and the human health risk assessment are, from the environmental world, feel like they encompass adequately human health risk, but it truly doesn't when we're talking about mental health impacts, community impacts, income, economics. It just does not fit the bill. So we're really advocating to ensure that this can be included, set up monitoring and surveillance for, as immediately as possible and into the future to understand what those impacts might be. And, most importantly, also mitigating any further impacts as early as we can. So thank you very much. I'll now pass on to Angela.
Wow. So thank you very much, Chief Slett and Linda. That was really great. Just quickly before we take questions, I need to plug next time's seminar, which is happening on February 23rd at 12 p.m. PST. Next time we are going to be talking about a crude oil guidance document that is being prepared currently by Health Canada. And that's being done by the Chemical Emergency Preparedness and Response Unit, with whom we've been working for the past little while. It's a really great collaboration. Basically what they're doing is they're doing a series of guidance documents on risk characterization and management of public health risks from chemical spills. So they have 4 documents currently, one on chlorine, one on ammonium, hydrogen fluoride, and then this crude oil document that we will be talking about on February 23rd. And the reason why I'm bringing this up is because they're looking for reviewers. So this document is aimed at public health practitioners, like the people in this room and on this call. Anybody involved in chemical emergency management. It has a question and answer style. It covers everything from prevention, planning, preparedness, to response and recovery. So they are very open to having people review this document and provide them comments. I've read it myself. It's a great document. They're also interested in speaking to potential collaborators on new documents. So other potential chemicals that they could look at might be hydrogen sulfide, hydrogen cyanide, phosgene, organophosphates, or any other of these kind of super scary chemicals that have greatest potential for mass exposure silent releases. So if you're interested in this opportunity, please reach out and contact Mark LaFontaine at Health Canada at the CEPRU, and he will get you set up. All right, so there's the 2 references for the documents mentioned at the beginning, and at this point we will open it up for questions. We can do it off the chat, right? Okay, so I don't know how to do that. Tina, help!
So should we start with the room first?
Riza?
Very nice talk, thank you. I understand that there are very difficult problems in managing this.
Sorry, Reza, did you come up here?
Oh. Don't touch it, don't touch it. Okay. Don't touch the mic. Right there.
Thank you so much for a very nice talk. I understand that it's very difficult to manage large spills. There is also another problem, because I saw that in one of your slides, you cited 6 spills in the past 5 years, which is in BC, which is the ones that are recognized by the government. And many different agencies are involved. But the truth is, by 10 times or even more, small spills are happening, and they are, like say, last year it was mercury on the ground, it was oil on a river, which are transient, the size is small, and there is no plan for them. And the local communities and people dumping the rubbish, which includes some chemicals. So maybe in terms of the size, they are not important, maybe they are not recognized, but in terms of health issues, they are, in my view, more important than the big scales, because the number are very high. For the next steps that you were talking about, is there anything as regard to small size, frequent spills that are happening?
That's a great question. Thanks, Reza. I think that I would point you towards resources on kind of like the cumulative effects assessments, but I don't know myself that much about small spills or who's working on them. It's something I think we can talk about more later. Are there any other questions from the room? Lydia? Run up here, come on.
Fantastic talk. Thank you very much. I was debating whether I should ask this, but I'm going to ask this because there might be a similar question in people's minds. And that is with the, well, we've all heard about the Trans Mountain Pipeline Expansion Project that will bring nearly, 900,000 liters of diluted bitumen and crude oil from Alberta to BC coast daily, and an extra, probably close to 300 extra oil tankers to the west coast. So these political, economical movements are happening, or may well happen. So what can public health and First Nations communities do? I don't know, but probably it means better preparation. Adequate, but what is adequate? So that's one question that we may or may not have immediate answers for right now. Second question is probably related, is how much do First Nations communities communicate with one another? Because we don't know when a next spill will happen, but likelihood it is going to affect on the West Coast another First Nations community. So how easy and how able is it for First Nations communities to communicate these best practices, lessons learned, especially the valuable series you've just undertaken?
For those of you who don't know, Lydia is the manager of the NCCEH, and so I guess she's just given me carte blanche to do as much of this oil spill stuff as I want to do. Basically, that's what just happened. So, did you want to?
So certainly with the approval of Kinder Morgan and the that project going forward, and certainly the Nathan E Stuart spill that happened outside of my community, it certainly magnifies how ill prepared we are, to manage these spills. And in terms of communities working together, we did reach out to GitGat right away after this happened and talked with their technical people, their knowledge keepers, their legal counsel in every aspect. Around their food security, we had questions, around what length of time was it safe to harvest, outside Hartley Bay after the Queen of the North sunk. So they've been extremely helpful with us. We also talked to other communities, the Haida Nation, other coastal First Nations. So we have a very strong network between First Nation communities. We were also supported by regional political organizations here in BC. And so in terms of going forth around safety and marine vessels traversing through our traditional territories, we will be sitting down collectively as a region and bilaterally with the government around safety measures. Part of it is with the recent announcement that the Prime Minister made with the Oceans Protection Act or Plan. So, that will provide for some discussion. One of the things that we do want to do in the new year is host a symposium around the learnings of what came out of this Nathan E Stuart spill. So, and that will include the spill response, the world-class spill response that has yet to be desired on the coast, and the different things in terms of what we talked about here today around the safety of our community with the long-term impacts and short-term impacts that community members experienced. So with that symposium, we would like to include, certainly what we talked about here today as a component of that, and would extend an invitation out to health professionals that we're working with to come out and join us for that. So yeah, certainly moving forward, there's a lot of work to do around spill response. Yeah, thank you.
Oh, actually, Linda was going to mention something about that.
Yeah, I was just going to add in terms of preparations in the future. There's the federal announcement regarding enhancing spill response on the coasts. And there's also been, over the last year, engagement sessions with BC Ministry of Environment to enhance the spill response regime for land-based spills. So those, that engagement is happening and the work is starting, but again, it is a lot of work. And how do you encompass the broad areas that BC has and the different types of spills and pathways that might occur?
Do you want to come up, Tom?
Thank you, Chief Slett, Linda Pillsworth, and Angela for a fantastic session that I think has informed everyone here and online. I'd just like to ask what sort of follow-up is going on with respect to long-term health consequences, social, emotional, and physical, that's happened as a result of this spill. Who's doing it, how it's being done, and how the community is being supported and involved.
That's a good question, and that's where I feel like the discussion around health impact assessment is important, and that is something that, because it's a lot more inclusive, we hope that it will start to incorporate those social and broader health determinants. It is something that we're working collectively with Heiltsuk and the Tribal Council in determining what's the right methodology, how to ensure that there's appropriate participation and relevance from an Indigenous and cultural perspective, because really it's not just epidemiology, it's a lot broader than that to make sure that all of the potential concerns are included. My hopes are that will help to facilitate monitoring programs that might be needed where they don't exist, and the ability to look at what baseline might exist already in the community, and look forward from there to at least monitor and be able to in the future look at what those changes in health determinants are.
So should we try to take a couple questions? So we're actually, unfortunately, almost out of time, but we really have to respect people's lunch hour. But we'll try to take a couple of questions from the chat box here. So just scanning through here. Yes, somebody here has asked, what is the ICS model? Can this be elaborated more? That's actually a really great point. I've actually, in the Health Canada guidance document, one of the questions or comments I made was, hey, maybe we could talk about what this ICS model is, or maybe people don't know what it is. So the ICS stands for Incident Command System. And basically what it is, it's a response structure. It's a way of organizing your response that takes into account, that groups together similar activities and helps them coordinate with each other. So you have a logistics section, a planning section, a communication section, and it just provides the framework for all of those different bodies of people working to work together. So as Chief Slett mentioned, they had almost 200 people come in for this response. So it is a lot of people. So the ICS provides a way to coordinate all those people. It actually derives from wildland firefighting. So it has this very hierarchical orders, top-down kind of structure, and it's very effective in quickly quickly cleaning up or limiting access to spill sites, for example. But through this experience that the Heiltsuk have had, there are some limitations to it, which is primarily in how do public health, and also communities like the Heiltsuk interact with Unified Command without actually being in it, and the sharing of information outside Unified Command can be a little bit tricky. So definitely this is something that we need to have more discussions around. But the ICS is a very well-established model and has a lot of public health benefits if we can also incorporate some of these other improvements.
rapid health assessment questionnaire?
Yes, the rapid health assessment questionnaire, that's something I was certain was going to come up. That is a point for further discussion. We will see. Because the community, it's focused to one community and to one incident, so that is something that we'd have to consider if it was appropriate to release or not. Also, it was done for the Heiltsuk and belongs to them. So Northern Health wrote in, I think that might be Barb Oak there, hello. We focus a lot of efforts on environmental assessments, have been thinking about better guidance and messaging for accidents, malfunctions section as it pertains to health. Based on your experience on the spill, what prior assessments, mitigations, plans, considerations, etc. do you think should be incorporated into the planning phase? Well, that's a nice short question to answer, Barb, thanks. Do you want to take a stab at that, Linda, or?
Sure. Well, okay, this is Linda here. I might not be able to answer the entire question, but I think as Chief Slett alluded to, not being equipped with the right equipment, the tools, the training to be the ones to be on site, knowing that they're the ones there, I think that's a very important piece to ensure that communities who are in closest proximity to these types of projects and points of contamination are they themselves equipped to be the responders. And having that forethought when these projects are created to understand what the capacity of the health units are. Because again, this is not day-to-day business for probably most health authorities. And so having that expertise and a capacity, or at least knowing where to create it, is important so that we can provide a better service to communities as well, and better response, so that the community is able to deal with the response, and we can work alongside on the health aspects. So that's a very big question. So that's a couple things.
Oh boy. So Julian writes in, given the ethical issues, is it a good opportunity to promote the recent work on health equity, environmental health, linking to through an equity lens, which is something that was recently put out by the BCCDC, by somebody who's actually in the room here, Karen Rideout, which includes system role to identify environmental health inequities, highlighting populations with higher exposures to harmful substances or that lack exposure to health supporting environments. Great point, great resource. Just go out and download it and read it.
The last one.
I guess I missed one.
From Kirby.
Again, this is either Chief or Linda. What kind of engagement and involvement response did Kirby Corporation provide? Engagement. Maybe the supper. They did that.
Yeah.
Did they? Oh. Did you turn us off? Or did I do something? Oops. Oops. Can we still talk?
Yeah, you can talk.
Okay. So Kirby was part of the Unified Command and had a representative at that Command Central, and we're in a process here in Canada where it's polluter pays. So they provided the resources for the operational, activities going forward in the community. Those discussions are still ongoing with Kirby, so we anticipate that we're, certainly going to be having those longer-term discussions with them into the new year.
Thank you very much. And I think we have to cut it off there because we're now over time. So thank you, everybody in the room and online, for listening, and see you next time on February 23rd.